Hi, my name is Pamela. I'm presenting this case, BPH, benign prostatic hyperplasia. William is an 76 years old male, comes to our clinic complaining of frequent urination. He states that he has urine frequency, urine urgency, and occasional incontinence. He gets up 5 to 6 times every night, but his urine comes out only a little. Sometimes he cannot make it to the bathroom. This problem becomes an issue and interferes his performance at work. He also has a history of UTI and was hospitalized 3 times in the past 2 years. His past medical history includes hypothyroidism, adenocarcinomas, colonic polyps, varicocele, lipoma, and COPD, iron deficiency anemia, DJD. His physical exams are not very significant, but on the digital rectal exam, a large prostate was palpated. The muscle has smooth surface. There is no firm nodule or any induration can be felt. During the exam, we also test IPSS on him. It stands for International Prostate Symptom Score. It is a score system based on patients' subjective answers for screening benign prostate hyperplasia. IPSS has 3 categories: mild, moderate, and severe. William's score is 18, which fit into moderate symptomatic category. So the prostate gland is a walnut size and located in front of rectum. The prostate goes through 2 main growth periods as man ages. During the puberty, the prostate doubles in size. Around age of 25, the second phase of prostate growth continues throughout man's life. According to a study by Zhang and his colleague, they determined the relationship between ages and the prostate size. They confirmed the prostate growth rate in width and height relatively stable, but in the age group of 60 to 70 years old, the growth rate by the length increased, exceeding the rate of the width. On the other hand, the length increased the fastest after the age of 60 years. As the prostate enlarged, it squeezed the urethra and make a man having difficulty to urinate. Eventually, the bladder becomes thicker due to hyperplasia. It's an increased collagen deposit within the bladder in an attempt to increase the force of contraction. Ultimately, the bladder becomes weak and loses the compliance. An individual with BPH will experience decreased flow urine urgency with a triple, incomplete, empty of bladder sensation, and frequent UTI. UTI is one of the common manifestations of BPH. The enlarged prostate blocks the flow of urine, which increases the growth of bacteria. UTI has burning sensation and intense urge to urinate. The risk factors are aging, diabetic. The high insulin level can trigger prostate growth factor, and obesity. Studies show men carry extra body fat have higher levels of estrogen, which can make prostate grow. Metabolic symptom also. So the next slide. According to Dr. Schmitz, the digital rectal exam is less sensitive and specific in diagnosing significance of prostate cancer. Yet, the digital exam is an invasive and uncomfortable examination. The PSA test is significantly detect prostate cancer. So he suggested do the digital exam only when the PSA tests are positive. Checking the urine is to check the presence of bacteria, and checking the BUN and creatinine is to check any injury from the obstructed urine outlet. Urinary function tests, including uroflowmetry and bladder scanner. Uroflowmetry is to test the strength of urine stream. It is used for detecting sphincter muscle. Patient will urine into a funnel-shaped device. An electronic uroflowmeter connected to the funnel, measuring the speed and the quantity of urination. Bladder scanner is to check post-void residual. The most invasive are pressure flow study. It is definitely diagnosing test for bladder outlet obstruction. It is more invasive and required to hood on the pressure bag for measuring the detrusor contraction. This slide is just showing you the significance of the pressure flow study on this patient was 74, but the normal should be 0 and moderate should between greater than 20 to 40, less than 20 to 40. So greater than 40 will be severe. So the treatment plan, before the surgery planning, medication are the #1 choices to treat moderate BPH. Alpha blocker like Hydrant, Cadura, Flomax are the most often prescribed medication. This type of drugs help relax the smooth muscle of the bladder and prostate. Second choice, anti-androgen agents such as Proscar, Avodart. They are selectively block androgen at the prostate cellular level to shrink the prostate gland. These two drugs class are good combination treatment for BPH. When the conservative treatment fails, in more severe cases, surgery consultation is necessary. Surgical procedure including traditional transurethral prostatectomy, TURP, and TUIP. The currently study shows that a less invasive treatment is called prostate artery embolization. This surgery procedure requires injecting microspheres into prostate artery to block the blood flow around the prostate to reduce the prostate enlargement. It's a very cool procedure, less invasive. It is only a trial. Next one, lifestyle changes, is recommendation of yoga or meditation. Yoga meditation can relieve stress and may reduce the need for urination. Kegel exercise can strengthen the muscles around the bladder. You can recommend the patient decrease fluid intake before go to bed, avoiding consume too much coffee or alcohol. Eating tomato. According to study, tomato is richest in lycopene. It is to lower the risk of developing prostate cancer. So thank you for listening and watching.